Hi, my name is Amelia. I'm a public health educator at MaineGeneral Medical Center. This presentation will cover basic information about the comparison of stimulant drugs and opioid drugs. To start off, what are stimulants? Can you name a few types of stimulants? The drug category stimulants includes cocaine, crack cocaine, methamphetamines, crystal meth, ecstasy or Molly, and prescription medications like speed, Adderall, Ritalin, Concerta, Dexedrine, and amphetamine. Stimulants are commonly referred to as uppers. When you take a stimulant, your body releases a ton of dopamine, which makes your brain very happy. This leads people to want to take the stimulant over and over again in order to feel the same levels of happiness. So those were stimulants. What are opioids? They're not the same chemicals, they're not the same drugs, so what are they? Opioids are drugs like heroin, black tar heroin, smack, street fentanyl, murder 8, medical grade fentanyl, codeine, and prescription medications like hydrocodone, Vicodin or Vicks, oxycodone, OxyContin or Oxy, Percocets or Percs, and morphine. When you take an opioid, the drug fits into your opioid receptors in your brain like golf balls on a golf tee. So opioids and stimulants impact the body very differently. They have different effects when you take them. Opioids typically cause feelings of sleepiness, drowsiness, slowed heart rate, and slowed breathing, while stimulants often cause the opposite effect like mental alertness, rapid heart rate, breathing, and high energy. Opioids and stimulants can have some of the same effects. For example, both opioids and stimulants can cause nausea, vomiting, itching of the skin, and a period of increased body temperature. Now, the long-term effects of when someone has been taking a drug for weeks, months, or years can be more significant. So long-term opioid use can cause significant liver damage, constipation, and other bodily changes like no menstruation in women, while stimulants can cause constricted blood vessels, teeth decay, and significant weight loss. Opioids and stimulants can have some of the same long-term effects. For example, they both can cause severe emotional problems, and they can also cause sleeping problems like insomnia. If you take a substance that impacts the way your body uses energy, like stimulants and opioids do, it will impact your ability to sleep, especially if you're going through a withdrawal period. Lastly, both stimulants and opioids can have long-term damage on your body if you are injecting a drug. Injecting any drug can cause vein collapse, tissue scarring, infections, and the risk of contracting diseases like hepatitis C or HIV if the needles are shared with others and come in contact with other blood. So out of all the drug overdose deaths in Maine, around 80% of them involved opioids in the past year. Opioids can be very quickly fatal. We know that stimulants like cocaine affect the human body very differently than opioids, but can you overdose on cocaine? Because cocaine is an intense stimulant, too much of the substance can cause a crazy fast heartbeat. If the body is overloaded by cocaine, your heart rate can reach a super high fatal level. Cocaine overdose can lead to heart attack, stroke, or seizure, which could all be fatal. It's important to remember that there is no naloxone or Narcan equivalent for cocaine. So if someone is overdosing, there is not a drug that will immediately reverse the effects of the cocaine on their body. There has been a significant increase in cocaine overdose deaths in Maine over the past decade. Additionally, there is no ideal medication to treat stimulant use disorder. However, there are some medications that have been proven to be effective and beneficial for some people. There has also been a significant increase in opioid use and increased opioid-related deaths over the past decade. Unsurprisingly to most, opioids are far more deadly than stimulants. However, there are very effective medications for treatment of opioid use disorder, like Suboxone or Methadone. It is essential to use medication and receive behavioral therapy to receive the full treatment for opioid use disorder.